Welcome back. This is Gateway 101. In Gateway 101, do not forget we places emphasis on prevention because we strongly believe that prevention is better than cure. So in today's video, we're going to be talking about how to prevent a certain illnesses. Okay. So we're also going to talk about malaria. But before that, remember that in Gateway 101 we do offer a simple home remedy. Okay, so we order in Gateway 101 we order healthcare awareness. We create healthcare awareness. That's what we do in Gateway 101. So we create healthcare awareness. So do not forget to subscribe to this channel and also like this channel. Okay, so we're gonna be starting. We have a little bit technical difficulty, but we're about to start. Okay, so we're gonna be starting shortly. Okay, so we'll be starting shortly. So now waiting room. Yeah, we're gonna be starting shortly. Okay, so do not forget to join us in this broadcast. Okay, don't forget to join us in this live broadcast. It's really packed and gonna be really interesting. As I said, we have a little bit of technical issue, but we're getting it fixed and we're about to get started as soon as we get this sorted. Okay, do not forget. In Gateway 101, we also provide a free ride to people who are going for their doctor appointment and who cannot afford or who do not have a means of going for their doctor appointment. So if you live in Atlanta, in Metro Atlanta area, you are having a difficulty, please do not hesitate to contact us. So we will assist you, to go for your appointment. Okay, so we do everything within our power to provide right for you to go for your doctor appointment. Remember that in Gateway 101 we place emphasis on prevention because we strongly believe that prevention is better than cure. So we encourage people to go for their healthcare appointment. So what we do is we call our team to help, go with you for your doctor appointment. So without wasting much of your time, we're going to be talking about malaria. What is malaria? What causes malaria? So all that you need to know about malaria will be discussed in today's broadcast. Okay, so thank you for joining us. Okay, so we appreciate you joining us. Okay, so let's get started without wasting much of your time. Welcome back. This is Gateway 101. In today's live broadcast, we're going to be talking about malaria. What is malaria? What causes malaria? How does malaria spread? And what are the simple home remedies that we can use to help alleviate these symptoms? So, malaria, please do not forget to subscribe to this channel. Do not forget to subscribe to this channel. We create a lot of healthcare awareness on this channel. Okay, so we are saying that malaria is a serious disease caused by a tiny parasite called plasmodium that affects your blood. It's mostly transmitted by mosquito. in a layman terms, it is mostly transmitted by mosquitoes. Okay, it is a serious disease caused by a tiny parasite called Plasmodium that affect your blood. So, what causes malaria? Malaria happens when a person is bitten by an infected female mosquito. A female mosquito is a type of mosquito that carries the parasite. So malaria happens when a person is bitten by an infected female mosquito. A female mosquito is a type of mosquito that carries the parasite. So how does malaria spread? Malaria spread mainly in this way. One, through mosquito bite. That is the most common method of infection. It spread mostly through mosquito bite. So an infected mosquito, do not forget that that a female mosquito carries the parasite. So if a female mosquito bit a person, the parasite enter the blood. So that person can then affect another mosquito if bitten again. In other words, you are bitten by a female mosquito that is carrying this parasite, Plasmodium. So, and if another mosquito bit that person, is automatically infected that person with the parasite. So, an infected mosquito bit a person, that parasite enter the blood, the person can then infect another mosquito. Do not forget that if another mosquito bit that person again, it carried the parasite. So if you bit another person, that person will be infected. So it's mostly spread through mosquito bite. Okay, the cycle continue from person to person through mosquito. That is the most common method of spreading malaria, from person to person through mosquito bite. Another way again would be from mother to baby. To, for example, a pregnant mother with malaria can pass it to her unborn baby. So another method again would be through blood transmission, but it's rare, very rare. It can also be transmitted through blood, can also be spread through blood transmission, but or transfusion, but it is rare. Okay, through blood transfusion with affected blood. So in other words, you're giving the blood to somebody who has a malaria. It can also be transferred to the person receiving the blood. Or you share a contaminated needles. You can also be affected. Mostly the person that uses the needle has malaria. So what happens in the body? Once inside your body, the parasite travels to the liver. Then it moves into the blood, infecting red blood cells. This causes symptoms like fever, shiver, sweating, headache, weaknesses. So if you are having, do not forget about this does not constitute medical diagnosis, okay? This does no way constitute medical diagnosis. So we are only creating a healthcare awareness. That's all we do in Get for 101. We don't diagnose in this channel. We don't treat in this channel. We only create healthcare awareness. So if you're having like a fever, high temperature, you might be having, it might be if you are bitten by mosquito and having a fever, guess what? You might likely be having malaria. You are beating a mosquito and you're having chill. You might likely be having a mosquito symptoms. So this you are sweating. Another symptom again of malaria is sweating. If you are sweating and you are bitten by a mosquito, so it may likely be a sign of Malaria, you're having a persistent headache. You are bitten by a mosquito and you're having a persistent headache. Most likely you're having a malaria. Weakness, you feel tired, fatigue. You're most likely having a malaria. So, simple way to prevent malaria: sleep under a mosquito net. There's a net you have around that you can sleep with. Okay. Use insect repairer. You can spray your house with insect repairer. Okay, or anti-insect spray. Okay, you wear long sleeve at night. Then remove standing water where mosquito bleed, because they bleed a lot through a standing water. So you must remove standing water around you because they tend to bleed and they bleed fast and easy. Okay, so take preventive medication. This got to be ordered by your medical health provider if traveling to a high risk area, especially third world country. Take a preventive medicine. Okay, not over the counter. This got to be prescribed by your healthcare provider. Okay, if you are traveling to highly risk or affected area, especially third world countries. Okay. Okay, so let's also talk about early warning sign of malaria. People often ignore. What are the early warning signs of malaria that most people often ignore? So, first sign will be malaria. At first, malaria can feel like a common illness. So many people mix it. They started with mild fever. They started having mild fever that comes and go, especially in the evening. The fever will come. Then you will deal with it all night. But during the day, it tends to subside, but it's always mild fever. So it comes and go. Sometimes it comes in form of headache. Okay, headache that will not go away. A persistent headache that will not go away. These are some early signs of malaria. Okay, persistent headache that will come and not go. That you feeling unusual tired or weak. You are tired. You are weak as the illness progresses. Okay, or body ache. Sometimes it comes like a flu. You're having a body ache all over. That's body weakness. You having a body ache. Sometimes lose of appetite. You find it difficult to eat because you're not hungry. Okay, you lose of appetite. So mostly when the disease progresses, you find it difficult to eat. Okay, no appetite to eat. So these are some of the early warning signs of malaria. Okay, you light chill or sweating. These are some of the early warning signs. You're having a nausea or vomiting, mostly as the malaria progresses. These are some of the early warning signs of malaria that people often tend to ignore. Okay, so as it gets worse, as the symptoms get worse, symptoms become more serious. Okay, we're talking about the early warning signs that people tend to ignore, but as it gets worse, the symptoms become more serious. High fever with shaking shivers. Those are some of the symptoms as the illness getting worse. Okay? So you're having a malaria. As it gets worse, you have a high fever, shaking with shivers. Okay, So as it get worse, the person tend to confuse, serious confusion or trouble thinking. It's as it's getting serious, it get the symptom getting worse. You're having difficulty breathing, and your eye become yellowish, jaundice, as the sickness progresses. Okay, so there are some natural way to stop recovering, or there are some natural way that you can use to help and elevate the symptoms. But do not forget that this does not replace proper medical treatment or proper medical medicine. Okay, malaria is serious and need medical treatment first. Then this natural way helps support the body. It is not a replacement for medical treatment. So drink a lot of water because malaria tend to dehydrate you. So you need to drink a lot of water, a lot of coconut water or soup. Eat nourishing food. Eat a lot of fruit like oranges and bananas. Eat a lot of vegetables, especially green leaves. Then light meal that are easy to digest. Do not forget that some of the early warning signs is nausea, vomiting. So you want to eat a meal that is easy to digest. Okay, rest a lot because it comes with a lot of fatigue. So you need a lot of rest. Okay, your body need energy to fight the infection. So you need a lot of rest. So boost your immunity naturally. Ginger tea help with nausea. Garlic may also support the immune response. You need a lot of vitamin C rich food. Okay? Good. So this will help. Mostly if you're taking a malaria medication, this will help in absorbing, proper absorption of the medicine to the bloodstream. So keep your body temperature comfortable. Okay? You can use a cool cloth for fever. Okay? Okay, how is malaria treated in the hospital? So, doctor treats malaria quickly to prevent complication. Do not forget, malaria can spread all the way to your brain. You become confused and unable to think as the sickness progresses. So, at the hospital, doctor treats malaria quickly to prevent complication. So they use anti-malaria medicine. This medicine kill the parasite in your blood, such as antihistamine based combination therapy, most common and effective. Okay, they also use chloroquine used in some regions. So chloroquine is very popular in the third world countries. They have so that what they use because of medication, because of malaria infection, because malaria is common and spread easily in the third world countries. They also use quinine. It's for severe cases. They use quinine. These are some of the medication they use to treat malaria. So, but depending on the severity of the illness, a patient might be placed on IV treatment. Okay, for severe malaria, a patient might be placed on IV treatment. Medicine given through a vein for fast action. So fluid to prevent dehydration will also be administered simultaneously. Okay, so symptom management, medication to reduce fever, very important. Get some Tylenol, ibuprofen, to reduce fever, and also monitoring blood level and organ function. Okay, so close monitoring. Doctor watch for complications like severe anemia, brain involvement, cerebral malaria, and organ failure. Do not forget I said that you have to take a proper medication before the natural home remedy to help alleviate symptoms. Okay, the natural home remedy does not constitute treatment. Okay, so you take a proper treatment and use the natural home remedy to help alleviate the symptoms. Okay, so we also encourage you to go to the medical emergency room if you had high fever with chills. Go to the emergency room immediately. You are confused, have confusion, having confusion or fainting, so repeated vomiting, trouble breathing, if you're having any of these symptoms, we strongly encourage you to go to the urgent care to seek medical help. Do not forget that we do not diagnose in Gateway 101, neither do we treat. We are only creating healthcare awareness. Okay? So let me explain malaria in layman terms. In layman terms, malaria is a sickness you can get from a mosquito bite. I've said that several times before. A tiny germ, parasite, live inside some mosquito. Okay, so when that mosquito bites you, it puts the germs into your body. So the germs make you feel sick. How it make you feel? You get a fever, your body gets very hot. You feel cold and shivering. Your head and body may hurt. You feel very tired. It can start feeling like a normal sickness, but it can get very serious if not treated. Okay, so there's a difference between malaria and flu. Fever for a malaria patient comes and goes, meanwhile fever for somebody with flu is steady. Okay, shivers, very strong shaking shiver, while for malaria patient, while um, flu patient will have a mild chill. Sweating for a malaria patient will be heavy after fever, while for flu patient will be light sweating. Headache for a malaria patient is common. Headache for flu patient is also common. Okay, so body ache. Body ache for malaria patient is yes. Body ache for flu patient is yes. Nausea and vomiting for a malaria patient is very common. In flu patients is sometimes, it's not common. Nose running for a malaria patient in malaria cases is rare, but very common in people with flu. Okay, sore throat is rare for malaria patient, is very common for people with flu. Okay, mosquito bite travel for people is very often. Okay, most people get it from when they travel out of the country to a third world country, but the flu is not related. Because most people get that when they travel out of the country. Okay, so without wasting much of your time, we'll go and recap again. Okay, so let's talk about malaria again. And we are saying that malaria is a serious disease caused by a tiny parasite called plasmodium that affects your blood. Okay, malaria. What causes malaria? Malaria happens when a person is bitten by an infected female Anopheles mosquito, a type of mosquito that carries the parasite. So how does malaria spread? I would say that malaria spread mainly in this way, through mosquito bite, which is the most common. Okay, an infected mosquito bite a person. The parasite enter the blood. That person can then infect another mosquito if bitten again. So the cycle continues from one person to another through parasite. Okay? Okay? So blood transfusion, we said that this is rare. Blood transfusion, true blood transfusion with infected blood, but it's very rare, it's not common. Sharing contaminated needle is another way of transmission, of spreading the mosquito bite. I mean to say, sharing a contaminated needle is another way of spreading the parasite. So what happens in your body? Once the insect bite you, the parasite travel to the liver, then it moves into the blood, affecting red blood cell. This causes symptoms like fever, chills, sweating, headache, and weaknesses. So, way to prevent malaria. It says sleep under a mosquito net, use insect parasite, repair, wearing long sleeve at war, removing standing water where mosquito bleed because they love a standing water and they lay these eggs in thousands and they bleed really fast. So remove any pool standing water in your yard. It should be removed or properly dredged. To prevent medicine, if use take a preventive medication if you are traveling to a high risk countries, mostly third world countries. Okay, so take that. So and I said that malaria can feel like a common illness, so many people miss it, they ignore it. A fever, okay, a fever that comes and gone is associated with malaria. Headache that will not go, a persistent headache is also associated with a malaria patient. Okay, feeling unusual tired to or weak, feeling unusual tired or weak, body ache like fluid. So these are some of the symptoms that you need to pay attention to before you travel. Okay, you're having a nausea, vomiting, you're also having a light chill or sweating. But if it gets worse, symptoms become more serious. Okay, high fever with shaking shivers, confusion or trouble thinking as the symptom progresses at it getting worse, difficulty breathing, yellowish of eye, which is jaundice. And we said the simple way to support recovery. Malaria is serious and need medical treatment first. So this helps support the body. So there is no proper home remedy to replace medicine at this time. So make sure you dehydrated, make sure you take your vitamin C that help absorption of the chloroquine or quinine. So and also help prevent and cool and common cold. So stay hydrated. Drink a lot of water, coconut water or group or soup. Eat a nourishing fruit like oranges, beans, vegetable, especially green leaf vegetable. These are very good source of nourishment. Light meal that are easy to digest. Okay, have a lot of rest. Your body need energy to fight the infection, so we have a lot of rest. Boost immune naturally, immunity naturally. Ginger tea also help with nausea, and garlic and may support immune response. Vitamin C, as I said, rich food also help in absorption. Okay, keep body temperature comfortable. Use a cold cloth for some time. Okay, mostly when fever is high. Okay, do not forget that the diagnosis in Ghetto 101 with many places emphasis on prevention. Okay, we don't diagnose people on in Ghetto 101. We create healthcare awareness. We also give you preventive tips so that you don't fall into sicknesses. Okay, so this is Gateway 101. I thank you all so much. How are you guys adjusting? How do you adjust when you are having a malaria? Okay, that will put up the simple home remedy to help alleviate malaria symptoms. Okay, you need to hydrate. You need to hydrate. You need to hydrate if you're having malaria. Very important. Okay, so we will be calling it a day for today because this is almost 12 midnight Atlanta time. So do not forget, if you're having difficulty going for your doctor appointment, reach out to us. We'll help you get you to a doctor appointment free of charge. You don't have to pay us anything. This is our simple way of saying thank you to the community that we stay. So Do not forget, prevention is always better than cure. Prevention is always better than cure. So this is Gateway 101. Thank you all again for watching. So for me, it's bye for now. Thanks so much. God bless. Stay blessed.